Yeah,
You did?
yes.
Good afternoon, Cedarfield family. Happy Monday, November 30th. I hope everyone had a great weekend, a great Thanksgiving. Thank you for tuning in to this live chat here at 3 o'clock, November 30th. Those of you that are listening tonight, if you have any questions about the information we're about to share, please feel free to contact administration tomorrow morning. There will be a memo coming out tomorrow that residents and team members can read alike to go over what I'm about to say here in the next 20 minutes. So first, a little current situation about the COVID-19 happenings around the nation and the Commonwealth. First, here, our 7-day positivity rate in the Commonwealth of Virginia rests at about 7.5%. That is up from 7.3 from Friday. Central Virginia has stayed the same at about 8.7%, 7-day positivity rate. Henrico is up from 5.5 now to 5.9. Richmond City is also up from 3.5 to now probably about 4. It's been rising throughout the day. And Chesterfield has risen also. Their 7-day positivity rate has risen from 8.2 to 8.5. So much of what you're hearing from the news and the media and reading or looking online is actually true here in and around our area. Cases are rising, hospitalizations are rising, and the 7-day positivity rate is also rising. So here at Cedarfield, we'll package this in between some good news here. Some good news here at Cedarfield. In the health center, up on the 4th floor, we have 3 neighborhoods, the North, Central, and South neighborhood. And as of 1 o'clock this afternoon, those 3 neighborhoods are in the green zone. We, team members and residents alike are doing great. And no signs and symptoms of COVID-19 up in the health center, so that's great news. Team has been working very hard to employ our preparedness plan to keep it that way. Residents have been extremely patient and tolerant in the health center, and the families as well. The amount of support from the families is, the stories that I've been hearing from the team about the families is very heartfelt. So those families that are listening tonight, we appreciate your cooperation and teamwork. We're all in this together. So that's the health center. All good news up in the health center right now. Same really goes for assisted living. Our dashboard is green. We have 0 signs and symptoms of any resident or team members, so that's great. The team also on assisted living is working diligently to employ our plan to keep people safe and alive. And again, a lot of accolades coming in from the family members. So the team members in assisted living just really doing a great job. Keep up the great work as we move into these next couple of weeks. Some good news down in Sunshine Plaza. We Many weeks ago, we were talking about 6 to 8, 10, 12 residents at one point we were up to that were COVID positive. Those residents have all cycled off of their 14-day quarantine or isolation. And so Sunshine Plaza has one team member left that will cycle off of isolation today, and that person will return to work on Wednesday. And so Sunshine Plaza, the isolation period will end here on Wednesday. We're going to, per guidance from the CDC and the Virginia Department of Health, and actually some of Medicare's guidance, we need to be 14 days free until we can lift the quarantining. Difference between isolation and quarantining. If anybody would like to learn a little bit more of that, feel free to contact the administration suite. But we'll still be under quarantine in Sunshine Plaza until we're 14 days free of a situation. So, but all good news. Residents and team members in Sunshine Plaza we're trending in the right direction. Our dashboard is green. And again, the team members down in Sunshine Plaza have just, when you see all those signs around the area and or on the media talking about the heroes among us, right now in Sunshine Plaza, the nurses and the CNAs and all the other support staff that are down there are our heroes, our unsung heroes, just working tirelessly, unselfishly to make sure that they're protecting themselves and their residents and doing the right thing, and it's paying off. That's the good news. So, good news down at Sunshine Plaza, and then some more good news in independent living. We had one person pop up positive here over the last 2 days, but other than that, in independent living, cottages, team members, and residents who live in the cottages and or team members who work in and around the cottages, and residents who live in the main building here and team members who work in the main building. That dashboard is green at this point. We don't have any signs and symptoms. We have one positive case, but we have contact traced that individual over the last several days, and we are not quarantining any resident or team member because of this one particular positive case that popped up here in the last 48 hours. So all of that is good news. So the downside to my news today has to do with probably what many of you have been reading in the newspaper or online and or seeing on the television. Because of the surge that is happening, we were on a call today with the Virginia Department of Health infection control specialists. There was 3 of them that were in attendance today, and we really want to be extra cautious right now in these 2 weeks. There was still really an unusual amount of holiday traffic in the Commonwealth of Virginia, which gave the Virginia Department of Health epidemiologists and infection control specialists another reason to have an abundance of caution in the middle of this surge. I think Dr. Fauci said it best, a surge superimposed in a surge that we've already had. The Department of Health is concerned, at least going into these next 2 weeks until December 10th. And the reason for that is most people don't know that they're carrying COVID-19. They're asymptomatic, they're walking around, and they have no signs and symptoms. And so most people won't know that they are at their most infectious period of time once they came in contact with it, when they're asymptomatic. That usually tends to be right around the 7th, 8th, or 9th day to when they were potentially exposed. And so that puts us really at December 10th, not just Cedarfield, but really Henrico County in general. The Department of Health is trying to work with every long-term care facility, community, nursing home, assisted living, and a retirement community like Cedarfield to really take these next 2 weeks really seriously, and not to frighten people, not to scare people into the practices, but really to do the next right thing and practice our shared values and take things up a notch. So what is taking things up a notch, as the one epidemiologist had said on a call today? We reviewed our Cedarfield plan with folks, including our dashboard, which is green for the most part, which is where we want to stay. Many of you have different families and friends that live at other nursing homes and retirement communities in the area, and that's just not the case. So we're pretty fortunate right now. So let's pray for our sister and brother properties around the area and make sure that they can move through their particular surges with keeping everybody healthy and safe. So we want to take it up a notch. And so what does that mean here in Cedarfield? And this applies for team members and residents. Residents are not in this alone. Renee and I field calls and emails, texts every day for the last 9 months, and that's probably one of the most frequently asked questions. Well, does this apply both for team members and residents? And so our plan does call for both. And so one big change that we're going to employ in order to reduce, yet again, the volume of people who are here at Cedarfield, we are going to eliminate from our current plan that Thursday, Friday, Saturday, 5 p.m. to 8 p.m. visitation period. On average, there's about 50 people that take advantage, 50 residents that take advantage of that particular program, which equates to about 75 people throughout the week additionally that come onto the campus. The Virginia Department of Health, along with management of Cedarfield, met today, and we believe it's best in the middle of this surge here to continue to reduce the number of people who come to Cedarfield. And so that's one layer that we are going to eliminate for the next 2 weeks through December 14th, and then we're going to monitor things on December 14th, do a recap on what happened December 1st through the 13th, get on another call with the Virginia Department of Health, and then talk about moving into the latter part of the month. The other thing that they are recommending to us, as management was talking with the Virginia Department of Health, is in terms of limiting the number of people who come to the campus, pizza deliveries, getting your piano tuned, all those other non-essential, I'll just call them non-essential items, a decorator coming to maybe change out your blinds. We're going to eliminate in these next 2 weeks those type of visits onto the property. And we're going to get back to where we were maybe in the beginning of April, where an essential visitor who comes onto the property needs to be cleared through Ann Hopper. If you are living in independent living, if you're living in Sunshine Plaza, assisted living, or the health center, then your neighborhood leader and or Matt Dameron can walk you through what essential is. And then the third piece, which is another piece that's probably not wildly popular, what I'm about to say. However, I do need to applaud a couple of residents who have called down to the office and said, we are going to impose our own self-quarantine without anyone telling us, because we know that the guidance suggests that we should stay put for 14 days. And so there's been a couple of people who have called and actually have told us that they're quarantining for themselves because they know it's the guidance, rather than Cedarfield saying that this is what we have to do. And so on November 18th, I believe the last memo was that we published, on the back page of that memo, and if you don't have the memo, I'm gonna post another one tomorrow with this Virginia Department of Health guidance as well. And the guidance talks about, if you're planning to leave Cedarfield, it talks about when you're out beyond the gates of Cedarfield and when you come back to Cedarfield. It talks about guidance. And this applies to residents and team members alike. And the guidance suggests, again, we're trying to limit the volume, the number of people who we are in front of. The guidance suggests that if you are out and about and you're visiting with folks that you normally don't visit with, when you come back home, whether you're a team member or a resident, you should strongly think about quarantining to protect yourself and protect everyone around you. And so over these next 2 weeks, during these live chats, we're going to be talking about how we can all support each other through the next first half of this month, because we're not going to mandate that you can't leave Cedarfield, but we are really going to keep concentrating on doing the right thing and making sure that people quarantine, because they're actually visiting multiple families, multiple households beyond the gates of Cedarfield. Team members too. Team members who are visiting multiple families over these next 2 weeks, we're going to ask them to quarantine as well and do the next right thing and protect themselves so that they can protect their fellow colleagues and the residents who live at Cedarfield. And so I'll put all this into a memo. It's about 90% drafted. I'll finish drafting it tonight, and we'll publish this next memo probably by late morning tomorrow, which talks about essential personnel coming to the community. As a recap, essential personnel only coming to the community, talking about visitation for independent living, talking about visitation for healthcare, assisted living in Sunshine Plaza. It will talk about the fact that residents are still permitted to leave Cedarfield. That's fine. If you have a car, you can certainly feel free to drive off the property. If you have loved ones in the area, they want to continue to come pick you up, and you go visit a son or a daughter off property, you're more than free to do so. So those type of things will be outlined in this memo that we'll publish tomorrow. Tomorrow is December 1st, and so Renee Langley has been at the helm for going on 9 months for documenting visitors that are coming to the property to pick up a resident in independent living, and we're turning that over to Will effective tomorrow. So anybody that has a need to call or has a need for someone to come onto the property to pick you up, tomorrow we ask that you call Will in the transportation office, and he'll get you logged in so that your loved one or your friend or your visitor can come and continue to pick you up here at Cedarfield. And then any medical pickups, so far the governor and the Commonwealth has not issued another executive order limiting your or our visits to the dentist or physicians any other subspecialists. So we're continuing to keep that log. Ann Hopper in the clinic is the one that's at the helm of making sure that we have a list of needs for visitors to come and pick residents up for medical appointments. And so we'll continue with that practice, and all that, again, will be outlined in this memo for tomorrow. So that is my news for today. Again, we want to be safe. We want to keep everybody healthy. As one of the epidemiologists said on the conference call this morning, we want to keep people alive. Yet we don't want to frighten people to death where everyone just isolates to their apartment and or cottage, or team members just are isolating in their own home beyond the gates of Cedarfield. Anybody has any questions? I have my phone with me. Anybody? I don't see any text come in right now. Wait a couple seconds here, see if any texts come in. Otherwise, we'll have another, just to recap, we'll post a memo tomorrow, late morning, and then we'll have our next live chat on Wednesday at 3 o'clock. During that live chat, we'll talk about COVID-19 and our evolving preparedness plan, in addition to some of the department directors who will give some updates pertaining to their area. Seeing no questions come in, I just want to thank everybody. We really are doing a great job. There is no doubt we're doing a great job. To see this type of dashboard in front of us, we're all taking it very seriously, and I think we're really doing a great job. And many residents, many team members, many families understand what we're doing, why we're doing it, continue to ask good questions. And so again, just want to thank everybody for the Thanksgiving week and keeping yourself safe and your family safe. There are many great stories out there of what people have done to do so. And again, to the residents of Cedarfield, thank you for placing your trust in us to live here and to work through this evolving preparedness plan. To the team members that are listening, again, thank you for what you are doing to work through our evolving preparedness plan to keep the residents safe, to keep yourself safe. This guidance does apply to team members as well when they're beyond the gates of Cedarfield. And so we will communicate with team members additionally with another memo and other forms of communication throughout the week to help set the stage for what team members need to do beyond the gates of Cedarfield in order to protect themselves, their family, and ultimately the residents when they come to work, they're protecting the residents. So if anyone has any questions right now or into the evening about this live chat, feel free to call the administration suite. Renee and I will answer any and all of your questions just as quick as we can. You can feel free to call my cell phone. Residents have my cell phone number, 727-479-5290. Otherwise, feel free to email me at the pinnacleliving.org site, mshaw@pinnacleliving.org. Feel free to contact any of the department directors, and they'll answer your questions just as soon as they can. Hope you all have a great night, and we'll talk with you soon. Thank you.